My name is Jun Wu. I'm professor in the Department of Environmental and Occupational Health at the Wen School of Population and Public Health. My research is about environmental health. I direct the lab called E3 Lab, and E3 represents environmental exposure, environmental epidemiology, and environmental health disparities. I do research related to a broad range of environmental stressors, such as air pollution, neighborhood and built environment, climate-related exposures, various health endpoints related to the environmental exposures, and environmental justice issues. I have been with UCI Public Health for about 2 decades. My recent research had a publication on the intersection of climate change and nutrition. So this came out of a unique opportunity. Last year, I worked as a climate and health scholar at the NIH Office of Dietary Supplements. And Margaret, who is the first author of this paper, came up with this idea of studying the intersection of nutrition and climate change, which has really been studied. And for my career as an environmental health researcher, I found this really interesting because I have been studying the climate change related health impact, but not so much on nutrition. So this is a perspective paper. We synthesized the information from the literature and we looked at the existing evidences and identified critical research gaps. So what we found is concerning. First of all, environmental changes, particularly climate change related exposures, really affect our food supply in multiple ways. First, the rising CO2 or carbon dioxide concentrations can reduce protein, zinc, iron concentrations in crops such as wheat and rice. These plants grow faster but become less nutritious. And then extreme weather events such as flooding, drought, wildfires, extreme temperature, like extreme heat and coldness, damage crops and disrupt the food chain, such as transportation of food, storage, distributions, etc. And also pollinators decline, and that threatens the fruits, vegetation, as well as nuts and seeds production. And this results that the nutritious food can become less available and less affordable and also simply less nutritious. And also, very importantly, the communities already facing food insecurity bear the greatest burden. And this isn't a future problem, it's happening now. And it affects both environmental sustainability as well as human health. We need a multi-pronged approach. The priority must always be addressing the root causes of climate change. And in this case, it's the first number one is to reduce greenhouse gas emissions. This is fundamental. And the environmental changes threatening our food supply and reducing emissions from the agriculture and transportation and our everyday life. And this is very essential. And we cannot supplement our ways out of a climate crisis. And second, strengthening the food system. This means making our agriculture systems more resilient to the extreme weather through the climate adapted crops, for example, diversify our farming practices, improving irrigation, and better infrastructures for food storage, food transportation, and distribution, etc. And it also means reducing food wastes, which contribute to emissions while nutritious food goes uneaten. And then third, we should ensure our food security. Even when food is available, not everyone can access it. We need policies to address affordability, support a food assistance program, and ensure that healthy food reaches communities facing the greatest barriers, including the low-income communities, rural areas, and communities affected by disasters. And also, within the broad context, in this paper, we ask the question, can dietary supplement play a supportive role? So first, we identified research gaps. For example, can dietary supplement help nutrient gaps when environmental disruptions have limited nutrients food? And under disaster recoveries, for example, when emergency food distributions often fall short of nutrients needs, can dietary supplement play a role? And second, can dietary supplement boost our resilience to environmental stressors, such as helping fighting for air pollution problems? And there are some evidences to show that like B vitamins, omega-3 fatty acid, and antioxidants, they may help counter oxidative stress and inflammation, those things that may be worsened by climate change. The third is that as people shift toward more plant-based diet for environmental reasons, how does that change their nutrients need? And all of these are research gaps we need to address. And also, here I want to emphasize that supplements are not a substitute for healthy food or fixing our systematic problem. If we can, we understand better through research, they can play a limited evidence-based role. And then we need to know when, for whom, which age group, and how much doses, and how frequent they use the dietary supplement. And with better understanding, we may better guide the public on such issues. So in terms of the research for the public health impact and implications, first of all, nutrition is often overlooked in climate health research and adaptation planning. So our analysis found that nutrition science is severely underrepresented in environmental human health research funding. And our paper highlights this as a critical gap that need attention. And also, we need interdisciplinary collaborations, bringing together nutrition scientists, environmental health researchers, epidemiologists, toxicologists, and community partners, as well as the funding agencies, to a better understanding the issues and to further bring this to real-world applications. And also, in terms of the policy applications, nutrition should be integrated into climate adaptation and disaster preparedness. Currently, FEMA recommends including vitamin, minerals, protein supplements in emergency stockpiles, but provide no guidance on specific nutrients doses and delivery methods and populations who can use those. So research in our first gap area could directly inform those recommendations. And also we need to consider affordability and accessibility, which is central to all of the public health interventions. And as I also mentioned, this is a multidisciplinary research. So we need researchers, funding agencies, and community partners to work together to better understand the issue and then better apply what come from our understanding to address the problem. Climate change is a huge issue, and nutrition is really understudied in that context.